Big breaking news that we are tracking at this hour. The Prime Minister, in an address to the nation, has announced that all vaccines will be provided free of cost to citizens above the age of 18. And therefore, this has put an end to the system which has existed now for several weeks in this country, where there were different vaccines, different prices for different groups, a certain price provided by the centre, a certain price bought by states, and a certain price in private hospitals, and there is no parity in prices in private hospitals between different states. This has resulted in a great deal of chaos at a time when vaccine availability has also been a huge crisis, and added to the entire process of India being far below the curve than where we needed to be in the number of actual vaccinations that have been done. But there is clarity now. Above the age of 18, 2 weeks hence, the centre is going to buy all vaccines from all manufacturers, the existing ones and those coming online. These will be distributed to states, and therefore states will then get free vaccines. If you want to pay for it, well and good. There's a 25% quota which is reserved for that, but no astronomical prices and no variable prices there either. Joining us now to look at this, Professor Giridhar Babu. We're joined by Dr. Rajesh Malhotra, Dr. Jalil Parkar, Dr. Krishan Chugh, and Dr. A.K. Gadpile. Thank you all very much for being with us. Dr. Babu, this is a decision, I would say, that couldn't have come a day too late. Would you agree that, forget the politics, what states, centres, parties have said, India needs vaccines, India needs one price will be given in 2 weeks from now. Is this not a welcome step?
Of course, Vishnu. I mean, there is no doubt on this. This is most welcome news. As the cases are also dwindling from the second wave, we would want to have something to start the next leg forward. And what more than having one nation and one kind of vaccine policy, which will ensure every person will have an opportunity to get the vaccine, and the central government being the sole purchaser, facilitator and distributor of the vaccine is a very welcome step. Although in public health we would have seen more of effort in terms of including better micro planning. How are we going to ensure all the vulnerable are going to get vaccinated?
Sure.
And the Prime Minister did touch on that on the CoWIN app. I feel this is a very nice and best step forward, Vishnu.
And I think the detail, Dr. Babu, in 2 weeks, he said it needs to be worked out, but in 2 weeks it will start being implemented. So that time is needed to see how it actually goes out. But this is such an important point that you mentioned, and I wanted to ask Dr. A.K. Gadpile about this. It's all wonderful and great that the price issue has been resolved, free vaccines. Now, how important is it to ensure that the last person in the most remote village, the poorest person, and the oldest person, the most infirm person, actually gets the vaccine?
A very important point, because the network facility may not be available at the remotest area, and we have to find out and give vaccination to all persons. That's why there should be some type of mechanism where the state government at the micro level up to the level of PSC and sub-center should do some sort of work, so that it will be came out as a truth phenomena that how the villagers is going to get vaccinated, because network facility may not be there. So district officers, district health officers should take a lead in this matter, and he should find out some sort of app where he should chart out some sort of network, so that there should not be any lagging for it. Because we are doing the TB program, and TB program is working very nicely. We have different types of apps in TB program, and we are feeding their photos and drugs and everything. So that is working very, very nicely. In this way also, our DHS, district health officers, or state government should make certain types of things, so that it should reach to poorest of the poor.
Okay. Dr. Chugh, the bottom line, however, now that we've resolved this nightmarish price issue, is this: where are the vaccines? Yes, it's going to be ramped up. Yes, it's going to be free to 18 plus, but where are they? Therefore, are we not getting ahead of ourselves?
Well, of course, if we can increase the production and distribution becomes more faster and fairer, it would be a very welcome step. But as long as we are unable to do that, whatever is available should be used most meticulously and in a very fair manner, so that every person who's most vulnerable and who are the priority get it first. And as has been said, that now it will become available for anybody and everybody over 18 years of age. I think that's a very welcome step. And this way we should be able to vaccinate our younger population also fast enough, because in this second wave we have seen that younger population is getting somewhat more affected, or at least equally affected compared to the older population. Welcome step.
Dr. Parker, one of the points that the Prime Minister spoke about, and it's breathtaking science, if it works, is a single dose nasal vaccine, and one of those which are, there's Codagenics, which by SII, which is in trials in the United Kingdom. I don't know if it's going to be trialed over here as well, but if it works and it enters our market in a finite period of time, will that not be a game changer, where you dispense a vaccine in the nose, and of course, assuming it works, the speed of dispensing it is nothing. The number of people who can be vaccinated fast, much quicker. The fact that you can travel with it, it can be taken around the country much easier. Therefore, will that not be a game changer?
Of course, that will be a game changer. When he said, he made his comments, I was very happy, because a couple of years back, one of the pharmaceutical firms was in the process of getting insulin as a inhaler. Unfortunately, it didn't work out, because I think it had some restrictive components of the lung.
Right.
So, of course, it definitely will be a game changer. And medicine always evolves, year after year, year after year.
But we should, at the same time, and Dr. Parker, you would agree, be ready for failures in some of the vaccines.
Of course.
And that is part of the science. We cannot expect that all of the 6 vaccines which are being trialed right now, all of them will work. We need to be ready to accept some failures, right? That's part of the... Right.
Absolutely. The moment you're not ready to accept failures, you have failed in the practice of medicine. Medicine is always, it does come along with failures, but we learn from our mistakes and we evolve and we do better, and that's how we start saving lives.
Okay.
So I think you're very correct in what you are proclaiming.
Right. Dr. Malhotra, okay, so hypothetically, if we get a single dose nasal vaccine, nothing like it, that's great science, not really worked in the past. Let's all pray that it happens now. But there are also single shot vaccines, that Sputnik Light, the numbers are resilient. Obviously, administering it takes a little bit more time, but one vaccine as opposed to 2 is again a game changer, right? Is that what India will ultimately need for us to get close to the 2 billion mark by the end of the year?
So absolutely correct, Vishnu. If you, I'm sure you paid attention when the Prime Minister said that the speed and the coverage are the 2 key terms he used. Now, speeding up can only be by speeding up the supply, but it can also be by single shot vaccines. Johnson & Johnson is a single shot vaccine. The Sputnik Light is a single shot vaccine. So that actually gives you immunity faster. And of course, there's talk about the nasal vaccine. There's also work going on oral tablets. Imagine if you had something which you could just pop in like a tablet that won't even need the cold chain, which possibly the nasal vaccine will need. So, the science, like it was discussed, is onto it, but there is going to be a lag. So that is why I think what he wanted to do was to reassure the country that the scientists are on the job. To me, there are 4 things which are important for vaccination or any public health program: availability, accessibility, affordability, and acceptability. Okay. He talked about the availability, saying that 7 companies are making and more companies are in the way. Affordability is now not an issue because everybody is going to get it free. The acceptability, he did touch about the myths and the hesitancy, and then of course the accessibility. Accessibility is again associated with the availability, because now it will be accessible to anybody regardless of his social status or. So I think it's the purpose of this exercise is actually, like you said, to clear all the confusion. In number 1, number 2, like uniform policy across the country, stop this blame game thing, and also to inspire confidence in the countrymen that the government is on the job, and the various strategies which he outlined to that end.
Dr. Babu, one final question to you. Now, you know, as a country, we need to be targeting approximately 80% vaccination, right? For there to be some sort of a herd immunity scenario where we have a relatively high level of vaccination and antibodies in our population. But assuming that that is not going to happen realistically by the end of the country, what percentage of our population should we actually try and ensure get both doses to epidemiologically see a fall, a drastic fall, like in countries like America or Israel or others in infection rates?
Yeah, that's a $1 million question, Vishnu. The answer to that is at least to cover everybody with comorbidities with 2 doses of vaccine, which is around 300 million. And as of now, till 45 years and above, there is definitely vaccine availability for all of them. But less than 45 years old, if anybody has comorbidities, they should be top on the list in terms of priority. But at the same time, there are also others who have the comorbidity but not diagnosed. So therefore, there has to be a connect between screening, ensuring that somebody who is at risk will get identified, especially in the remote areas, urban slums, and the villages. And this is where our maximum effort should be, Vishnu.
All right, I'd like to thank you all very much for joining us. Request you to stay on for a few more minutes. I need to take a short break and we'll continue the big story. Vaccines for free for all citizens above the age of 18 across the country, announced by the Prime Minister. Implementation starts in 2 weeks. That's the big story. Stay tuned. Welcome back. The big breaking news story. We continue to track free vaccines for all citizens above the age of 18, announced by the Prime Minister just about in fact, less than an hour back. This starts being implemented in about 2 weeks from now and puts an end to this debate which has existed in this country on whether it's right for states to be paying for this at all. It's also come at a time when this has been brought up in the Supreme Court of India, and now this has been decided upon. I wanted to quickly go back to my panel. Dr. Gatpail, the bottom line over here is that the centre will now need to pay. The amount we don't know, it'll be tens of thousands of crores most likely. And therefore, that's a factor we also need to keep in mind, right? It's a very expensive proposition, and that the payments or the payout to vaccine manufacturers, which has been missing in very substantial amounts, will now need to be outlaid. So I think you're on mute. Could you just fix that? Yeah. Yeah, go ahead, sir.
Your idea is very clear. Because the policy of the government is that it should reach to the each and every people of India. Now, for this program to reach out to the poorest of the poor, the participation of individual, participation of community, and efforts of government. If 3 are there, then and then it will be successful. So what is the idea? Getting the persons and community involved. First is education. You have to make them aware that this is an important life-saving medicine or coming the bad future.
Right.
You have to tell them first. Then you have to make them in a collaboration way, which UP government is making. UP government, what they have done, like our hospital is doing, our School of Medical Sciences is doing, that we outreach to the societies.
Absolutely. Dr. Gatpail, I was actually trying to get a fix on the costs or the numbers. Let me go to Professor Babu for that. Professor Babu, the biggest problem India has had, many would say, last year, at a time when countries like the United States, by the middle of last year, had bought 400 million odd doses of vaccines. India had bought none. Our first order only came in the month of January, that also in paltry numbers. The financial outlay required for what the government now says, the Prime Minister now says, would possibly be tens of thousands of crores. So that is something which is a considerable factor. That this is also a massive financial commitment which has belatedly been taken by the government, presumably.
Yeah, yes, Vishnu. So in the budget, there has been an allocation of 35,000 crores just for the COVID-19 vaccines. And even recently, the finance minister and also from the Niti Aayog, we have heard that there is enough allocation available for purchasing of the vaccines at the central government level. So I'm not really worried about the financial outlay as such. However, as the Prime Minister made very clear in his address to the nation, the suppliers are few. So in terms of how do you use, because if you go through the routine tender way of calling for the vaccines and then paying later, it may not work out now. So some kind of advance payments, as other governments have done, will have to be made. Those are the mechanisms the center has to work out now, Vishnu.
All right, so that needs to be looked at very, very closely. Dr. Malhotra, given the fact that different vaccines cost different prices, there's no one price that the center will be buying at, right? So Sputnik costs just under 1,000 rupees. Codagenics, when it comes, will cost something. Covishield is already more expensive. Covaxin is already more expensive than Covishield. Biologic E will have a different price, perhaps the cheapest in the country. So this is all something the center will need to, and if Pfizer comes and the center buys it at, upwards of $15, $20, $30, it could be anything. So this all needs to be factored in. There's no one price of acquisition.
Absolutely. And like you said, I think the most pleasant surprise for me was when I realized that the BE indigenous vaccine was going to be the cheapest one.
Yes.
And, you can't help it. You need to source the vaccine from different manufacturers, and you need to import them, and you can't have a uniform price. And that's why we have always been saying that it should not become, I want this one kind of attitude. I think everybody, especially if you're getting it free of cost, you must take what you're getting, because all the vaccines which are available, you should not look at how expensive they are, because an expensive vaccine does not necessarily mean a more effective vaccine. That is decided by the data, not by the manufacturing price. But I do understand that this is a challenge. But I think, having said that, having one vaccine policy and with the center buying all the vaccines and distributing it, I think that will remove this kind of confusion where the states will not vie for a cheaper vaccine, or people will not sort of avoid a vaccine because it is more expensive. So I think it will bring them all to the same platform, because they'll all be getting it free. But then, of course, the burden, the financial burden on the government will be high. But that is something we have to accept.
All right, thanks very much. I'd like to thank all my panelists very much for joining us. I'm out of time on this discussion. I'm going to quickly move on, try and track various reactions to this. Akhilesh Sharma, my colleague, joins me at this stage. Akhilesh, the center has come under stinging criticism from so many state governments, the Aam Aadmi Party, the Trinamool Congress, among others, right? The Punjab government certainly on its policy, the Shiv Sena, you want to keep going on. This puts an end, at least for the moment, to one part of the controversy. There's the entire issue of procurement, and then there's the entire issue of who pays. That who pays matter has been resolved.
Absolutely, both the matters have been resolved. In fact, Vishnu, that who procures, because we have seen how the state governments they have floated global tenders, but without any success. They could not find even a single supplier in the international market, because of course there's shortage in the international market also. And as far as the pricing is concerned, the central government is already providing free vaccines to 50% vaccines to entire population. But then the states, they also wanted their share, so they had suggested that they should be given the freedom. Now the state had given that, and in fact I have a letter with me which was written by Odisha Chief Minister Naveen Patnaik on 2nd of June, and this letter very clearly suggested that how things were moving in this direction, that the central government should take the procurement in its hands, because the letter says very clearly that he has already written to the central government and also spoken to various chief ministers who are in this favor that the procurement should be done by the central government. So after Naveen Patnaik's move, I believe that it was a way out, which was to the standoff which we have seen, the way you have mentioned about Aam Aadmi Party government in Delhi or Uddhav Thackeray government in Maharashtra or Punjab government. There was a constant friction between the center and the states, and the cooperative federalism was it was not there at all. And for such an important matter which happens in a century, as the Prime Minister himself has said, of course now there was a need for both the center and the states to work together, and now this has been resolved.